can I just move you on to the subject of COVID? Obviously, thankfully, the government have relaxed all of the conditions. Better late than never as far as people like me are concerned, but it's very welcome nevertheless. I just wondered, from your perspective, how you felt that was going. And also, given what's happened, do you think that if another pandemic struck, the government would be less likely to go for full-blown lockdowns and instead more focus on shielding the people who are most vulnerable and let people manage their own risk?
Yes, I do, Philip. And I think it's fair to say that we have collectively learned a lot through this pandemic. Of course, the pandemic itself is across the world. It's still raging. It's not over. So we need to remain on our guard. But as a country now, we are the most open country in Europe. People are getting on with their lives and like normal. And that's great to see. And in every respect, both socially and economically and in every other way. And we can do this because I think as a government, if we look back at recent decisions regarding the pandemic, we've made the right decisions. We were right to open up in the summer. Many countries did not do that. And we were right to focus on vaccines and antivirals and other treatments and also testing during the Omicron wave. And of course, as I said, we've got to remain vigilant. So we've got to have good surveillance. We've got to keep encouraging people to come forward for their vaccines if they haven't done so yet, because that protects not just them, but all of us. But we are in a very good position.
One thing that I've noticed, and I wondered if you'd comment on this, is that quite a few parts of the public sector appear to be bringing back in or not even getting rid of some of these COVID restrictions by the back door. So, for example, if you go to a court, the court will say, everybody there must wear a mask, even though the government guidance has been changed for the rest of the country. Is there any way that you can make sure that the public sector follow the government's lead and also what the government's now saying to the rest of the country?
Well, I can certainly speak for my part of the public sector, which is very large, obviously the health and social care sectors. So already we have removed in social care all the sort of restrictions that did exist before on visiting rights and other types of restrictions. Of course, we still want to make sure that there's testing available in social care. Older people in residential homes in particular are more vulnerable. In hospitals, there are certain tests either of staff and individuals we would do because people there are, again, more vulnerable. But a lot of the rules and regulations around this are either have been removed or gradually are being removed. And it's good to see. I think we all want to see a return to normal. I know for if I think about my youngest daughter at school, she's really pleased she doesn't have to wear a mask anymore like she did just a few weeks ago. And I think it's really important that throughout society that we start returning completely back to normal.